Okay, so another great way how to do a release to some of the scapular muscles that are limiting external rotation, which is often seen in patients with shoulder and scapular stiffness, is to do one where you are kind of doing a pin and stretch with a lacrosse ball or a therapy ball underneath some muscles in the armpit while you're rotating the arm forward and backward with the use of your hand alone, or if you need some assistance with a pole. So the important thing is really finding the exact location where you will be finding those muscles. So ultimately, you want to be able to feel the outside of your rib cage or outside of your shoulder blade, and you'll feel right up from, if you go to the middle of the armpit out to the side, you'll hit the outside border of that shoulder blade, and you can travel that all the way down. And on the inside of those that shoulder blade, you can kind of pull inward, and you can feel some musculature that sits right on the inside. You can go all the way up to kind of the middle of the armpit. All right, now to confirm that you do have those muscles, you can go ahead, put your get your finger, your right finger on some of those muscles, and then take your left arm and put it on the inside of your thigh, and you can go ahead and push downward, inward, internal rotation into the thigh to kind of confirm that you're there. So then you want to feel that spot. You want to take the ball and put it directly in that spot, right on the inside of the shoulder blade. A lot of people miss this and they put it kind of like directly in the armpit, or they put it too low, but it's really finding the border of the scapula, then coming off into the inside and up close to the armpit where they lie. But confirming it that you're on the right muscle by pushing down into the knee, and you feel a muscle pop into your finger. If you're not feeling a pop, you're not feeling where the muscles are. So ultimately, just make sure that wherever you're pushing, you can confirm pushing inward into the leg. So I'm gonna go ahead, you're gonna lay down now, you're gonna pin the ball up underneath the armpit. Okay, lacrosse balls work very well for this. And you can do two things. One, you can do, we're pinning it down on there, find a tender spot. You might need to move around a little bit, forward and backward, get up in the armpit a little bit more. But once you've found it, you can come inward and you can come outward. Come in and come out, come in and out. You can even roll forward and back, okay, to get some cross friction to the tissue in different directions, okay? There's not one better than the other, but the pin down and then you go with the active range of motion really works well to release the tissue. You want to make sure you're going to the full end ranges of each motion, internal rotation and external rotation. And if you have a little bit of trouble going in external rotation, you can use a pole, and you can go ahead and rotate the pole back. And you'll get a little bit more range of motion as you pin down the ball and try to work and relax that muscle into external rotation. Okay, so it lengthens the tissue of the muscle while you're pinning it down and desensitizing the area. All right, you can do a couple hold pauses, okay, but about 2 sets of 10 of the active range of motion will really help to release the tissue. All right, thank you very much.